This is a CJASM podcast, and I'm Nick Larkins, paediatric nephrologist and author of a recent publication on the timing of kidney replacement therapy among children and young adults. We looked at data for Australian and New Zealand people with kidney failure from 1 to 25 years of age who started treatment between 1995 and 2018. This study was performed using data from the ANZ Data Registry, which has the benefit of including nearly all Australian and New Zealand centres providing kidney replacement therapy, including every paediatric centre. Over the study period, the median eGFR increased by what sounds like a relatively modest 2 mils per minute adjusted for body surface area. However, in practice, this equates to months and years of additional time on dialysis or managing a kidney transplant for young people and their families. We demonstrated a greater rate of change among people starting kidney replacement therapy with a kidney transplant or peritoneal dialysis compared to hemodialysis, and that the trend includes young adults being treated in adult centres, the opposite of observed trends among older adult patients. The rate of increase in eGFR over time was 3 times greater among those in the 90th quintile of the distribution, that is, those starting dialysis earlier than 90% of their counterparts. When we constructed a survival model using eGFR at initiation of kidney replacement therapy to predict patient mortality, there was no association between eGFR and mortality. However, adjusted for patient factors such as age, era, the etiology of kidney failure, there was a positive linear association between eGFR and mortality. That is to say, those who started kidney replacement therapy at a higher eGFR had higher mortality. This is interesting because it mirrors data from the United States and Europe. In lieu of any studies suggesting benefit, how then do we explain the observed trends to earlier initiation of kidney replacement therapy? Given the difficulty of performing a definitive trial in this population, more research including outcomes specific to children and young people is required to answer this question.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.